Good afternoon, everyone. My name is Jackie Burgess Bishop, and I have the distinct privilege of being the CEO for the National Kidney Foundation of Illinois and welcoming you to this phenomenal webinar we're having this afternoon, Telemedicine, Know Before You Go. We thank you for taking the time out of your busy afternoons for attending, and we are so thrilled to have our esteemed panel. It is my privilege at this time to turn over the broadcast and the panel to our moderator, Dr. Tipu Puri. Dr. Puri is a nephrologist at the University of Chicago Medicine, and he is the board president for the National Kidney Foundation of Illinois. So, Dr. Puri, thank you very much.
Thank you, Jackie. So it's a pleasure to be here with these panelists who are not only active in the National Kidney Foundation of Illinois, but all of them are colleagues over the years and friends. I'll start as president of the board of the National Kidney Foundation of Illinois. We bring these sorts of programs to you because of our mission to improve the health and well-being of people at risk for or affected by kidney disease through prevention, education, and empowerment. And as Jackie mentioned, I am a nephrologist at the University of Chicago, and I've been affiliated with the NKFI for most of my 15+ year career. I'd like to also ask each of our panelists to introduce themselves, starting with Dr. Ricardo.
Thank you, and welcome everyone to this webinar. We are very excited to discuss telemedicine with you. I am a nephrologist as well, and I have been working at the University of Illinois Chicago for over 10 years.
Thank you, Dr. Ricardo. Dr. Desai?
Thank you, Tipu. Welcome, everyone. We're excited to have conversations with you today. I am a transplant nephrologist, and I've been working at Loyola University for about 5 years now. Excellent.
And Dr. Udani.
Hi, Suneel Udani. Welcome, everyone. Thank you for joining us, and thank you for having me on. I'm a nephrologist with a practice in the community called Nephrology Associates of Northern Illinois, Indiana, or NANI. And I'm excited to be here and hope to have this to be a helpful thing for everyone involved.
All right, I want to start by thanking all of the panelists for taking some time for this important session to educate patients in this new era of how you interact with healthcare that has developed out of the pandemic. So before we start, a few housekeeping notes. We would like you to use the chat panel at the bottom of your screen to ask any questions throughout the webinar. Myself and the staff will be monitoring, and we will distribute those questions to our panelists to respond. Today's session is being recorded and will be available on the NKFI Facebook and internet website. So that you can go back and re-review or direct others that couldn't join us live today to view the webinar. Part of the reason we developed this is that with the COVID-19 pandemic, it became necessary to protect patients, especially at-risk patients, which are CKD patients and transplant patients. Certainly would fall into that category, but at the same time maintain care, both living with a kidney transplant or living with chronic kidney disease are situations where it is important that you have ongoing and regular touch points with your physicians and with your medical teams. And telemedicine, video medicine, rapidly advanced over the last few months to try to fill some gaps. But it's important that those interactions be of a quality that they are meaningful. Just saying hello to your provider on the screen and checking in, that's nice, but in order for that visit to really take the place as much as possible of a face-to-face visit, there are certain things that need to happen during that visit, certain things that patients can do to prepare for that visit to make sure that they happen. And we're going to get some perspectives from our panelists on that. So we're going to move to our first poll question. And you can respond to this. Have you participated in a telemedicine visit? I suspect many people have, but there are probably some that that have not. Those on chronic dialysis are likely still getting face-to-face care for the most part, rather than doing televisits with their nephrology care, but certainly other aspects of care, you may have gotten televisits. All right, let's see. So we have about 2/3 of those joining us today that have participated in a telemedicine visit, and still a third that have not. I think that's actually a larger number than I was expecting so far. Dr. Udani, any surprise? Are you surprised by that poll result?
I am a bit. I think that seems like most offices, at least in this area, but I imagine that the people who have joined may span across the region and even the state, and therefore where there's been less density of individuals that have been ill, there may not have been as much of a need or a pressure to have telemedicine visits, or as you mentioned, the patients on dialysis certainly for the most part have been still seeing their providers face to face. So I suspect as we move through the program, we'll be able to tease out more what those different experiences have been.
Great. So I want to move to our first panel discussion question. That is, was your organization using telemedicine prior to COVID-19? And let's start with Dr. Ricardo.
Thank you. At UI Health, we were using telemedicine services for very specific populations. As a state institution, we take care of prisoners, and some of the departments within medicine were providing telemedicine services for that population. Us in the Division of Nephrology were new to the telemedicine system, so we had to very quickly learn how to implement it in our day-to-day lives.
And is it something that was it the same system that just got expanded, or was there new systems that were developed?
We are trying to expand the prior system, but we actually started to implement a completely new system with a private platform to provide telemedicine service across the different departments.
Great. Dr. Desai, how about with the transplant patients? Was that something that was ongoing, or is that something that has developed since the pandemic hit?
So prior to COVID, we actually had plans in place through our lung transplant program to begin doing telemedicine, because given that they're an extremely vulnerable population and some of them were being seen out of state, we wanted to have that capability to communicate with them off of campus locations. From the transplant nephrology standpoint, we had not pursued any telemedicine on our side. So just as it was with Dr. Ricardo, it was a whole new terrain for us, and we had to have a really quick learning curve with it. We began with using a private site and just converting everyone over to telemedicine as much as possible. And now the institution itself is looking at our Epic platform to use the Loyola site that we have for patients and have it through the internal system. So we're attempting to convert to that at this point.
Dr. Udani, in the private office setting, was this something that existed prior to the pandemic?
No, we hadn't really, we hadn't experienced it before, and it wasn't really on our radar, to be honest. So it's been a very steep learning curve for us. I think that, when you categorize telemedicine, I think the formal appointments is what we're referring to. Obviously, before this, calls to patients in between appointments is a common thing that's done, and at least it provided some, at least, context for how to expand on that. But in terms of a more formal approach that we've been doing now, it was very new to us, and we are, I think, still going through the learning process of how to make it the most accessible to the most people.
Yeah, I think our University of Chicago experience is similar to my colleagues. It was something that we were talking about. I mean, certainly, nephrologists and other doctors interact with their patients on the phone all the time, whether it's following up on lab tests or giving advice. But the idea that an actual routine follow-up appointment would be conducted either over the phone or over a video call was something we were considering, but hadn't implemented. But the pandemic really forced us to accelerate that. We're going to move to our next poll question. And this is, which of the following forms of telemedicine have you used? Live video, phone chats, live video, phone, or chat visits, secure email communication where you have to go to a specific patient portal, remote monitoring devices at home, say for weight or blood pressure or other data, mobile at-home labs, mobile health apps. And I believe you can probably select as many as apply. There's probably some things that we are calling telemedicine now, or telehealth that we were doing, and now it's just all getting lumped under, this bucket of telemedicine. Here we have the results. So it looks like more than 2/3 have participated in the video or phone visits, email as well, but very few have been using the remote monitoring devices, mobile at-home labs, or mobile health apps. What I guess what I don't know is, were the respondents only allowed to pick one answer, Monica or Rachel?
Yes, just one, sorry.
Okay, all right. So perhaps other forms of telemedicine were being used, but we forced you all to only pick one. Dr. Desai, any thoughts about this? I think some transplant patients get some other forms of home monitoring, or maybe labs drawn at home.
Yeah, so we participate in live video chats with patients through the telemedicine, but we do have mobile health and lab draws set up for patients, particularly as part of studies and with some of the other companies where they will go out and draw labs at specific timeframes for our patients so that they don't have to leave their home at all. And that has been valuable to us, because really important to us in preparation for having a telemedicine visit, of course, is to have some blood work to look at, to share results, to talk about conversion of anti-rejection medicines. And so we actually have found the mobile health apps very valuable to incorporate that into our telemedicine face-to-face conversation with our patients.
Dr. Ricardo, some mobile monitoring or home monitoring, has that been in existence at UI Health, or is that something that you're expanding?
We are currently not using remote data collection for clinical purposes in nephrology. However, in the research setting, as part of the chronic renal insufficiency cohort study, we are doing remote data collection. And that has helped because a lot of patients enrolled in the CRIC study are patients of mine, and they call me all the time to let me know where the creatinine is or their urine albumin and so on.
Dr. Udani, with your dialysis patients, is there any home monitoring in terms of weights or other things that have been implemented or used?
With our home dialysis patients, we have a large home population, and so we've utilized, the home dialysis setup that I think most people use is through a company called Next Stage, and they're as part of the home dialysis setup, we have real-time monitoring of blood pressure. The dialysis treatment parameters are sent from an iPad that the patients have, and they're sent via Wi-Fi to the clinic. And so that's something we've had before, but that was still mostly used in that, reviewed in that face-to-face visit. Now that we are doing things remotely, that's been quite helpful for us to get a more complete picture of how treatments are going and how to troubleshoot certain issues. In terms of the in-center patients, though, not to date. We have really not implemented more than that, but there's certainly a growing push to do that, and we are expanding our non-dialysis patient population, the use of remote monitoring programs with the plan to have patients have blood pressure cuffs at home, scales at home, so that they can monitor some of the things that we would look for, primarily so they can optimize telemedicine visits, but also, even more importantly, to identify health issues that may be arising prior to when they become a critical point, and ultimately hope to prevent people from deteriorating where they need to be hospitalized.
That's great. I want to stay with that thought and stay with you, Dr. Udani, for a moment. So, what is the best way for a patient to prepare for a visit?
So similar to an in-person visit, I think there are some important things that are helpful, and one is, of course, questions that you may have, because I think in the whether you're talking about live or via telephone or video, in the realm of the discussion or during the context of the discussion, it could be easy to forget some of the things you may want to bring up with your provider. So I think that coming up with a list ahead of time is always helpful to specific concerns you have and questions that you like to answer. In terms of what's specific to the the remote or the virtual televisits is as much of the physical data as we can have. So certainly from a kidney standpoint, blood pressure, weight, blood sugar, those are the things that we certainly utilize to help make an overall assessment and to best guide how treatment decisions can be made. And so if those things are accessible, that will certainly add much more value to the televisit. I think the advantage, of course, of being at home is that your medications are readily available, and so there's a discrepancy in terms of not sure which of these pills you should be taking. You have those right at hand, and so having those accessible at the time of the appointment can be very helpful. The other thing I've found, again, similar to in-person visits, is having someone there with you, if possible, a care partner that even if you're on the phone, I usually ask people to put on speaker if they have someone else there, so that so both parties or multiple parties can hear the discussion. Because again, for a patient, sometimes we hear things and our train of thought may be diverted, and so having another set of listening ears is helpful. So even though you're not physically going to the office, I would still try to coordinate with the people that otherwise help you with your health, so that they can be part of that discussion.
That's a great tip. Dr. Ricardo, your thoughts on the same question?
Yes, I have a list of tips, and some of them were already mentioned by Dr. Udani, but the first one is basic. Stay home if you can for many reasons. Realizing this is not always possible. However, if you're in the grocery store or elsewhere, it might be hard to listen to the doctor or have enough privacy or concentration to make the best out of the visit. So if you know the time at which the doctor is going to call, it's best to wait for the call at home. And I would recommend having a paper and pencil at hand in case you need to write down any recommendations that the doctor need to give you, such as the name of any new medication or changes that you need to make to your current medication, or dates of future appointments, or any type of instructions that the provider is giving during the visit, since you're not getting the paper discharge summary that you would normally get after an in-person visit. And then, as Dr. Udani said, it's very important to have all of the medications that you're taking at hand so that we can do the medication reconciliation over the phone, and also check whether you need any refills so that you can get all your medication refills completed during the telemedicine visits. Again, write down all the questions so you don't forget. During the visit, which happens very often, you have questions in mind, but you don't write them down, and then you forget to ask during the telemedicine visit. Again, taking the vital signs is very important, the blood pressure, if you have a thermometer, or temperature as well, especially during the COVID pandemic, and the weight, of course, and keeping a log if you're checking your vital signs on a daily basis, which is great if it can be done, keeping a log of that and having the log available for the visit. And also keeping track, sort of a file of your health records. If you go to any other facility, emergency department, hospital, procedures that may not be within the healthcare system of the provider that you are encountering during this telemedicine visit, that's also important. And lastly, during the visit, if find the spot in your home where you have the best telephone signal or the best Wi-Fi signal. And if possible, if you're taking care of children, because I know a lot of you are caregivers right now with the schools closed, having children running around might be very distracting. You're doing your telemedicine visit. So if you can find an entertainment for them during your telemedicine visit, that would be great.
Yeah, I think to that last point, taking advantage of the convenience of being at home, but treating this like an actual visit with your doctor where you can focus on your own health issues. Dr. Desai, any additional thoughts?
No, I concur with my colleagues. I think that being prepared for the visit is the most important. I've actually found that the telehealth has been nice for us in that way, because many times patients come and they've forgotten a log at home, or they've forgotten their medicine list. And it's the convenience of being at home has been great in that if they don't have it at the moment, they can certainly walk around the house and find it. So I've seen some of those benefits with the telehealth as things that our patients may have forgotten to bring. They're easily accessible at that point.
Yeah. We have a comment coming through the chat pointing out just the challenges with different platforms and different technology, and some of the additional support that has been put in place to try to help get the patient ready for the telehealth visit, maybe perhaps a pre-call with the medical assistant. Dr. Udani, is that something that your teams are practicing?
Yeah, I think that, but I think it's a very, very important point, because this all happens so quickly that I don't think that people, I mean, as the medical community as a whole, was prepared to have a cohesive way to how to do this. And I think, introducing it when someone was in the office would probably, before the pandemic started, if we would have had that kind of foresight, would have been perhaps made that transition smoother. We do have people call ahead the day before and the day of to help them navigate the technology. but we know that the technology is not perfect, and it's still, despite that, oftentimes led to at least in the using the virtual appointments through video. The telephones have been pretty reliable, but I think that the learning experience that we've had, certainly through our practice, is trying to figure out which of these platforms that became widely available very quickly was truly also prepared to handle this. And we found that there certainly are ones that have been more reliable and less cumbersome for the patient, and others that are more cumbersome, that require a separate app to be downloaded and a separate login and things like that are, I think, difficult for everyone to always do in preparation for an appointment.
I'm sure we will see some further development in the technology that will hopefully make this more accessible and easier to access for patients. I want to move to the next question. Does a telemedicine visit replace an in-person visit? What could a patient expect during a telemedicine visit? And for that, I'd like to start with Dr. Desai.
So I think that an inpatient visit has so much value in that sort of face-to-face, able to examine the patient, know that if you're complaining of swelling in your legs, or you're having some chest pain or chest pressure, those are things you can't access by a screen. And it's much more convenient from the physician standpoint and even the patient standpoint to deal with acute issues in a face-to-face manner. I think in transit, what we found is if it's just a regular sort of visit, a monthly check-in to see if the labs are okay, the patient's doing well, then telemedicine has value because they can have their labs done at a local facility ahead of time, and then we're able to review the labs. But nothing, I think, takes the place of that physical visit and that physical exam that you're missing with telemedicine. I'll say for us that we also find it challenging to do more complicated care on telemedicine. And so for our patients who we're trying to consent for an evaluation for transplant, we've moved to mailing them the consent form and then trying to do an hour-long televisit, teaching them all the things they need to know about post-transplant medicine, transplant care. And those things have been a bit of a challenge. But I think just bear with the physician on the other end, the coordinator on the other end, know that technology has its issues. I've been tech support myself and trying to get patients through things. But I think that once the patient's gone through it one time, then it becomes that much easier the next few times.
What's your approach to the telemedicine visit with a patient? Is it the same as an in-person visit? What can a patient expect when they're getting on the video with you?
Yeah, I think it's essentially the same. I know I get on, I say hello, make sure they're being safe, make sure that they're not having any symptoms of any kind. I go through the list of my usual symptoms that I would go through in a clinic visit. The thing that's missing is that physical exam. And some of it we can try to take care of. I'll have them move their screen down to their legs so I could see how swollen they are. But if it goes beyond where they're feeling skipped beats or palpitations or chest pressure, those are the challenges that I think we face mostly. Again, I find that it's valuable if they've forgotten anything as far as logs or sheets, because I can ask them to just go get them and then we sit down and go through them. So I run it similarly like a physical visit I would do. The only part that's missing really is that physical exam component.
Yeah. Dr. Udani, your thoughts? Does a telemedicine visit replace an inpatient visit?
I think I would really echo what Dr. Desai said. I think that I think the most difficult things are what she mentioned in terms of the physical exam. The other is an initial visit, initial meeting with a patient. And I think that ultimately we're still social creatures, and we rely on meeting a new physician. There's a huge leap of faith you're taking in that person's care, and so not being able to see them face to face, not being able to look someone in the eye, I think it can be difficult to really establish the kind of rapport that's required, especially with more complicated conditions like chronic kidney disease or the variety of things that that develop subsequently. And again, along the lines of what Dr. Desai said, even in patients that we know that have seen us before, or we've seen before, some of the complicated decision making that's required. Again, there's something else I think of value in physically seeing someone. And so, all being said, I think a lot of what we do, while physical exam is important for, a lot of what we do is counseling, and in that respect, I think the telemedicine visit lends itself to more of that counseling, really focusing on that conversation, which I think is helpful. And if there are resources that they can get to, if it's online, you can share your screen and things like that you could show them. Those are things that can be helpful. In terms of what a patient would expect, I think that similar to what Dr. Desai said, I would go through things in the same approach. I think the other difficulty is that naturally, I think all of us want to give the patient that we are seeing at that time, or virtually seeing at that time, as much time as they need. And so in the office, there's a little bit more. There's the waiting room, and people are sitting and maybe talking to our assistants or with family. Whereas if people are expecting a call at a certain time, it can be difficult because they're in this limbo where they say, well, is it going to happen at 2:15? Is it going to happen at 2:30? And I don't want to, go to the bathroom, and then they call and it's things like that that are naturally. And so I know that I've run into that trouble where, I've gone behind with one patient and the patient's not sure if I'm still going to call them or whatnot. And so they may go do something else. These are things that I think we're still trying to work out in terms of, how to best optimize that time frame when people are going to connect over the phone.
Dr. Ricardo, do you approach your telemedicine visits pretty much the same as an in-person visit, or are there different things that you do?
It's very similar, as Amishi and Suneel mentioned. It's pretty much the same, except for the physical exam findings, which I relied on the patient and their caregivers to give me information regarding physical findings. So I think for stable patients that are not having a lot of new symptoms, a telemedicine visit can replace an in-person visit. But as mentioned before, if the person is having new symptoms or symptoms that may suggest severe complications of a disease, then an in-person visit, obviously, it's the way to go.
We have a question that has come through the chat about the comment about different platforms. This participant is asking whether any of the panelists are aware of any platforms that they've found to be better or that are certified for either in terms of privacy or accessibility or ease of use. Anyone aware of just a quick poll, which platforms are you all using? Dr. Desai?
So we use a platform called doxy.me, and we found that has been the easiest or simplest way to communicate with patients. Essentially, I plug in your phone number and I send you a text message to your smartphone or smart tablet, whatever it may be using. And it just says that the post-kidney transplant team would like to connect with you. Then the patient will log on and click on the link, log on as their name. They put themselves in the waiting room. And then on my side, I would see that the patient has checked in. I click on their name, and then the video pops up and we're able to communicate with each other. We do have a platform that we're going to be trying to move through, again, through our center base, but I don't think that we're there yet to know if there's ease of use there. And then just as Dr. Udani mentioned, timing, we find with that platform is going to become critical in that the patient is going to have to check in themselves, and if a time lapse occurs, then they're going to lose their spot. So I think that the doxy.me has been the most valuable so far, and we're going to be experimenting with our internal one soon.
Dr. Udani, quick response. What platforms are you using?
We have used in our dialysis clinic Microsoft Teams, and then the Office platform called Office MD, which has worked fairly well, although it requires a separate app for patients to download, which again I do not feel is always easy for people to do.
Dr. Ricardo, same question.
We use, for the most part, Doximity, which is similar to Doxy.me that Dr. Desai described. And then there is another app called InTouch that some providers are using.
And I can tell you at the University of Chicago, we've been largely doing this using Zoom or a encrypted form of Zoom, and through the chat, another participant mentioned Microsoft Teams also because of the encryption. So I guess in response to the question, everybody's using something different right now. I guess we'll see over time whether we see a leader of the pack in terms of products and platforms, but clearly ease of access for patients, privacy, and the technology facilitating the visit are going to be factors. Let's move to our next question. If COVID-19 risks were reduced or eliminated, would you want to continue telemedicine? This is a poll question for everyone to respond to. So if COVID-19 risks were reduced or eliminated, would you want to continue telemedicine? Dr. Desai, do you find yourself wishing to go back to before back in January or December? Do you ever catch yourself thinking about you know?
So I have to say that of all my partners, I was the least ready to take on telemedicine, and I let them all kind of experiment with it before I even jumped on the bat. But now I really enjoy it in some respects, and especially for our patients who have trouble getting here or they've had a hard time getting here in the past. And I see value in it moving forward in that way of use. If we have patients that live 4 or 5 hours away and it's difficult to come to continuous appointments, and from a transplant perspective, post-transplant, where we see them almost twice a week, I see a lot of benefit in that. And I don't feel that it's the easiest for the patients to come back and forth all the time. I also am hopeful that in the future, we can start to begin to see patients then out of state as well. And I can see a lot of value in telemedicine use in that going forward. But for the person who didn't want to do it before, I've actually enjoyed it in practice. So.
I guess I would lump you into then the pretty much unanimous response in our poll. It appears that this is something that everyone wants to see stay. I'll put this out to the panelists. Dr. Udani, maybe I'll start with you. What else is needed, do you think, in terms of what's the future of telemedicine? What else is needed to improve it, to make it more successful?
You know, if we are asking telemedicine to replace in-person visits, then I think that whether we're talking about providers or payers or whoever it is, needs to give people the support that they need. So that means, one, having tools like blood pressure cuffs and scales that are reliable, and a way for that data to be transmitted to the providers and less dependent on the patients, writing things down and then reporting them. This technology can be done seamlessly. It seems like it's certainly the potential for it. We just have to widen the accessibility of it. I think that, as many people that have gone through remote learning or virtual classrooms have already recognized, is that we need to reduce these large gaps in technology in different areas. The accessibility to high-speed internet, to reliable, service like that. If you're going to make it really I think video visits are superior to telephone-only visits in terms of just making those connections and at least some of the physical exam. And I think to have that, be reliable, I think you need to have a reliable internet connection. And so, if we as a medical community are going to advance the utilization and utility of telemedicine, I think you can't separate out widening the accessibility of that technology.
Dr. Ricardo, same question for you. I wonder if you could pick up on Dr. Udani's comment on comparing video visits versus telephone visits, and then from that, what's needed to make this better so that it's stronger in the future?
Yes, in addition to Dr. Udani's comment, I think we need better internet for everyone. In my opinion, or in my experience, having not reliable internet has been the greatest barrier, especially given the population that I see at UI Health, a lot of minority population without either Wi-Fi or a smartphone. So a lot of times they have to rely on their smartphone of their family members. So I think we need better access to technology for everyone, in addition to the monitoring devices that Dr. Udani mentioned.
Do you think there's a role, such as this session, that using telemedicine is something that we have to teach?
Yeah, definitely, I think so. We all
on
need,
both sides, probably, right?
Yes,
both providers
exactly.
and patients.
Yes, absolutely.
Dr. Desai, any specific transplant concerns going forward? Things that need to be added in to make sure that care of transplant patients by telemedicine can be as effective as possible?
Yeah, I think the one hurdle we found was if patients decided to take the opportunity of COVID to maybe move to an area that didn't have a high volume of COVID, and they chose to spend their quarantine time, let's say in Michigan or Wisconsin, is that we didn't have insurance malpractice privileges to see them across state borders, which made it a bit complicated for us in taking care of our patients. I would love to see that they actually, if we were to use a telemedicine resource in transplant specifically, a sort of global malpractice support for physicians, or ability to see across state lines, because that would really improve our access to our patients, especially if they choose to move to a second home or somewhere else during a pandemic, or be closer to other family members. There's many reasons for patients to not stay where they are and quarantine elsewhere. And we found that to be an issue.
So some regulatory adjustments or revisions that need to be made to facilitate telemedicine as well.
Yeah.
All right, let's go to our next audience question. Oh, is it just? Oh, it's audience Q&A. So this is, we're just opening it up and seeing if there's some questions that come in from the audience. You can direct it at specific panelists or to all panelists, and then I'll pick one for you. What's been the downside, the negative with the telemedicine though? I know the direct patient interaction is something that we all enjoy, but aside from that, have there been other downsides to it? Dr. Ricardo, I'll start with you.
I think we mentioned some of the downsides. I can't think of anything else other than the lack of the opportunity to do a physical exam, which we already talked about, as well as the interaction, especially with the new patients. I had some awkward conversations with people that I never met before. I shouldn't say awkward, but serious conversations. And obviously they've never seen my face before, and I had never seen theirs before. So I think the being humans and needing social interaction is important, and it's reflecting during this time.
So Dr. Ricardo, I want to stay with you. There's a question that came through the chat here. Have there been any language or cultural barriers or gaps that have impacted your telemedicine practice?
Well, I am very fortunate to speak Spanish, so I can overcome that barrier easily. With other languages, we have a system. Unfortunately, we cannot do video through that language interpretation system, so we have to use telephone calls exclusively. But the way we do it is we call the language interpreter line, and then we do a three-way call with the patient, and that has no language barrier because there is an interpreter for just about any language.
Dr. Desai, any cultural or language issues that have propped up in your practice?
Yeah,
with
similar to
telemedicine?
Dr. Ricardo, we found it very challenging to do any interpretive telemedicine that was through a video platform. And so we always converted those to just telephone calls, which I think, just as Dr. Udani had mentioned, seeing someone at least face-to-face to communicate is much more preferred than just to pick up the telephone and have that conversation. And so that any language outside of English, we had challenges with telemedicine.
Dr. Udani, I want to go to you with this next question. Do you envision CMS and private insurance payers supporting the reimbursement or payment for telemedicine services to make it sustainable?
I guess I don't see the reason not. I mean, it hasn't been widely adopted outside of primary care before this. But I think that, in terms of, there certainly is a push to remote care monitoring. And I think this as an extension of remote care monitoring, that if individuals are, if it's an environment where people can come to the office and people want to come to the office, great. But if there are scenarios where they are not comfortable or are unable, certainly a connection with their provider should help to ameliorate health conditions before they get to a more critical place. I think we've had also, and not in the nephrology realm specifically, but we've had experience with remote monitoring through a certain cardiac device that monitors pressure in the arteries going from the heart to the lung. And that's been in place for the last few years. And a lot of our patients that have kidney disease have heart disease as well. And we've utilized that for the last few years as a means of identifying when people may develop fluid retention prior to even becoming symptomatic. And we know that based on published data as well as our own experience, that has undoubtedly prevented people from deteriorating and ending up in the hospital. So, there's going to be more, I think, stories like that and more data like that. Right now, we don't have a great comparison because everyone's been on, telemedicine for the pandemic. But in terms of the ultimate ideal, which is from a care provider standpoint, keeping people healthy, keeping people at home, not in the hospital, and then most of those goals being shared by payers, I can't see that what would be the argument against that. But it doesn't mean that there isn't one.
I'm gonna put you all on the spot for a second and ask, do you think you can provide the same level of care via video visit as in person? And I appreciate the comments about the physical exam. I know we can't do a physical exam, and that is very important. But just in a general level, do you feel comfortable providing ongoing care to your patients via telemedicine? Dr. Desai, can I start with you?
Yeah, I do think that I feel very comfortable providing telemedicine to my patients. Of course, not a fresh transplant patient who has an incision or something that still needs to be addressed. But once they're stable 2-3 months out from their transplant, I think that there's not a world of difference between the physical visit versus telemedicine. Certainly, if they're a complicated case, then that's a different issue. But the majority of patients moving fine and having smooth outcomes, I think that there's not a significant difference outside the physical exam, as you mentioned.
Dr. Ricardo?
Yes, I agree. As long as I have my laboratory results available, my blood tests, my urine tests available, and especially for established patients with whom I've had a relationship from before, I think I can provide the same level of care with telemedicine.
Dr. Udani, I'll give you a chance to comment as well.
Yeah, I think, echoing everyone else's comments, I think that as long as both providers and patients prepare in the same way for a telemedicine visit as we do for a in-person visit. And that becomes not just a casual phone call, but really a set aside time that, we're focusing on one thing. Both parties are. I think that, again, for a large percentage of patients that we're talking about counseling and things like diet and reviewing how to move forward in their kidney related care, I think that telehealth services work as well and sometimes better.
The next question asks you all to kind of predict the future. Do you expect telemedicine visits to increase again in the fall? I suspect that's a surrogate question for whether we think there's another surge in our future. Who wants to take that one? How many think that that we will probably ramp up telemedicine visits again periodically? It'll be a little cyclical for a while.
I think the more we prepare for that, the better outcome, the better we'll do. I think if we wait for when the next surge happens, or then we'll kind of be in the position we were this time, which was figuring out the technology, running into having gaffes from a technology standpoint. But I think that if we plan for that, saying okay, that those can be moved in person, but at least let's prepare people that this could be remote, and let's try to give them the tools to succeed in having that an optimal visit. I think that's going to be the better way to handle it.
Yeah, I can tell you with my own practice, we've gone back to all in-person visits, but I got such a positive response from patients about the ability to do some visits every now and then as a remote visit, as a video visit, that I've added separate, complete, dedicated video clinic sessions, so that it's possible that some of my ongoing patients might choose to do, if I see them 3 times a year, 2 of those visits might be in person and 1 might be an intervening visit, might be a video visit. So I plan to maintain a dedicated video clinic going forward. Whether CMS will continue to support it or not, I don't know, but I felt pretty moved by how much the patients valued having that form of access available to them as well. We're coming up on the end of our hour. We have time for a few more questions if they come in through the chat. As you sat and listened to your colleagues, any other thoughts pop into anyone's mind? Any things we failed to discuss in terms of your experience with televisits? Dr. Desai, transplant is such a multidisciplinary practice as well, especially in the immediate post-transplant period. How have your surgical colleagues and social work and pharmacy, how have they all kind of integrated into this?
Yeah, that's a great question. Actually, I tend to forget that we have these multidisciplinary teams. And so we are fortunate to have 2 Spanish-speaking surgeons. And so actually we integrated them to do televisit from the video platform with our Spanish-speaking post-transplant patients, because we were having such difficulty doing that outside of that in-person, knowing the language and the language barrier. We haven't, on the post side, had as much issue incorporating other staff members, because if we needed a social worker to talk to somebody or a pharmacist to call someone, they were always doing that by phone anyways. But on the pre side, we had to come up with a unique way to run clinics so that you had an education session to get a consent to start working somebody up for transplant, and then set up a visit with a physician, and then subsequent visits with a nutritionist and a social worker and all of that through telemedicine as well. So clinics that used to happen in 1 half-day session, now we're spanning the week with different time slots for every team member to incorporate themselves in telehealth with the patient. So it got complicated to try to do this. And that was probably our last hurdle, was figuring out how to do an evaluation without ever seeing a patient face to face.
Do you expect your dietitians or social workers to start to use video more though? I found that there's a certain intimacy with the video visit that I was surprised by it compared to the telephone visit. I wonder if the social workers in particular, but even the pharmacists and other members of that multidisciplinary team might start to use video visits more.
Yeah, actually the social workers demanded having that video visit. And part of that is we all know there's nothing more valuable than seeing someone's facial expressions and being able to interact with them and see what they're truly saying. And so the social workers have been using the video platform for simple things such as just medication changes and other things that we've stuck to the telephone, but definitely our social workers are on board already with that.
Wonderful. Any closing thoughts from the panelists? Dr. Udani?
I just think it'll be helpful to hear, we've heard all of our perspectives. I think that the upcoming patient perspective, basically, a grade of how we're doing. How are we doing at this? What do they like about it? What they don't like about it? I think that that's going to be critical in how we shape this moving forward. I think that Dr. Puri mentioned the feedback he's received. To be honest, I haven't heard a lot of feedback per se. I think more, I've heard people say we miss seeing you, or miss people who come in the office. And there's a few people that certainly have said, this is much easier. But I think more systematically understanding what this experience has been for patients and how they feel, how comfortable they feel with it, I think will be helpful to guide how we utilize it moving forward.
Dr. Ricardo, closing thoughts from you?
Yes, I agree with you, actually. I think moving forward, we should give our patients the option of having 1 or 2 visits per year via telemedicine if they want to do so.
Wonderful. Well, I want to invite everyone to keep the conversation going. You can visit nkfi.org for information on kidney health, upcoming NKFI events. Dr. Udani mentioned a similar webinar plan to get the patient perspective on telehealth, and we will all be waiting and listening for that feedback with excitement. Please remember to follow NKFI on Facebook, Instagram, or Twitter for real-time updates. I want to thank you all for joining the webinar today. A recording will be available on the NKFI website and Facebook within the next week. And again, save the date. Our next webinar, August 19th, Telemedicine, a Patient Perspective. So thank you all for joining us. I wish you all a good day and good health.
Thank you.
Thank you. Thank you.